Welcome, everyone, to NRBP's webinar. I'm Barbara Kaufman, Executive Vice President and COO at Newark Regional Business Partnership. We will begin momentarily. We'll just give attendees a little bit more time to join. Okay, I don't see more people coming in right now, so I think we're ready to begin. I will say welcome again, Barbara Kaufman, Executive Vice President and COO at Newark Regional Business Partnership. We're very happy to see all of you today on our continuing virtual program offerings. Today's webinar is a continuation of the series that we did in the spring on returning to the workplace. And now as we enter the fall, we have a lot more knowledge about how the virus is spread, what sorts of precautions we can take in order to be able to help ensure that we are containing the virus to the greatest degree possible. The format for today is that I'll be doing a little bit of a review of our upcoming programs, and then I will be introducing our first speaker for our topic today, COVID-19 and the workplace. And we named it, there's an app for that, in light of our second presentation that we'll hear today from Kirusa. Some of you will remember Bruce Groves from the April presentation, and Bruce will be updating us on some of the environmental actions that you can take in your workplace to be able to have it be safer when you do bring employees into the workplace again. But first, some notes about what's coming up and just some words about format. First, in terms of NRBP's calendar, tomorrow night we're proud to be launching a new version of our happy hour that we held in the spring and into the summer. We're doing them monthly now instead of weekly, and we're partnering with one of our members, John Ward of Cool Vines Newark, the newest wine shop and in the Haynes building in Newark. And John, as our partner, has identified a distributor, De Maison Selections, and Andrea Fulbright will be doing a short presentation followed by an opportunity for everyone to introduce themselves. So I hope all of you will sign up for that. Whether or not you enjoy wine, it's a great opportunity to be able to connect with some fellow members and make connections. Next week, we also have another networking format, our NRBP Nexus, and we will be featuring a new service provided by one of our members, Pride Products. It's called Connectorship. It's a very fast-paced game that allows you to be able to connect with other people who are involved with the game. We all tried it, and it's a fun way to break up your day and also to be able to make connections. The following day, we're continuing with our Diversity, Equity, and Inclusion series, led ably by Maya Curry, our Communications Director, and this installment will be on education. And I really encourage all of you to sign up for that. It's been a fascinating conversation, and what we're looking at are racial and economic disparities, and the topic of education is one that's so important because the disparities are great, and we hope that by addressing this topic we can elevate the conversation and continue to advocate for change to make things more equal. Then on October 14th, we have what we had hoped would be a live event, but unfortunately we decided that we needed to keep it virtual, and that's our annual Regional Economic Outlook. And I'm particularly excited about this year's installment because the two big issues that we'll be talking about are the election and also the continuing discussion about COVID-19 and what it means for businesses. And we'll do our usual economic report, followed by the panel of industry leaders, including a political scientist from Montclair State, who is going to give us some reflections about what polls mean, how to interpret polls, and what you can see when you look beyond the polls in terms of what might happen. So please make sure to tune in for that and register as soon as possible for that event. Then on October 28th, we have another installment of our DEI series on healthcare. This is also an area where there's a lot of important information about how the paradigm can be changed. So that's our lineup through the end of October. Now moving to the format for today. First of all, please make sure you look in your chat box. There is a message from Kirusa on how to get a discount on the app, and they'll talk more about it in their comments. All of you will be muted and off camera for the duration of the program. Please post your questions in the questions area. Kirusa has told us that they will make the presentation available after the program, and Bruce will confirm that when he does his presentation. That's often a question that is posted. So when we get to about 2:40, 2:45, our speakers will pause and I'll check the questions box and review the questions for the speakers, hoping all of you do pose your questions for the speakers. So with that, just encourage you to periodically check your chat box for messages about anything relating to the screen or to format, and add your questions to the questions area. And now I will go off screen, and it's my great pleasure to turn the program over to Bruce Groves.
Well, thank you, Barbara. You have some interesting events that are coming up. It's a shame we couldn't put the wine event along with this one. I think that would have been a good option to have. So let me talk a little bit about what has been a topic that people have been talking about for 6 months. And as Barbara said, I gave a presentation trying to predict and trying to give a little bit of overview of what we're finding with COVID-19. And my background is in air, in transmission risk, in exposure assessment, and also dealing from an environmental health and safety standpoint. How do you protect yourself? And as part of that is we take a risk-based approach in pretty much everything we do when we're dealing with different types of hazards like chemicals and radiation and infectious disease. So that's where I come from, and that's been kind of the message we'd be going. And a lot of this work was doing that. It's really important to understand that this is a serious illness, but it's also important that you can get people back to work, because like you can protect them from a lot of other hazards, you can surely protect people from this hazard. So I'm just going to give a little overview and then pass it off to my friends to talk about their app. The goal originally was to not overwhelm the healthcare system, and I think that was a major part when we were looking at March and April. Of course, we always want to keep people safe, and we also want to keep people working and the economy moving. So 3 simple goals. Excuse me. As a reminder, when you're dealing with this virus, there's a couple things that I think it's very important, and the data is really showing that this is in fact the case. In that when you're dealing, what do we know? We know that you need to have prolonged proximate patient contact. And when we talk about proximate, this is where the social distancing comes in. That's within 6 feet. And this is a transmission risk, and the data is showing this from people to people. It's not picking up lettuce or contacting surfaces. The great majority of the passing and the people who are getting sick, or at least getting positive with regards to COVID, is because you have a patient-to-patient or face-to-face contact. It's not just 6 feet, but it's also prolonged 6 feet. So if you walk by people, that's really just casual contact, and the chance of having exposure is minimal. So you're talking about many minutes here with prolonged. And the third thing is you really need to have a patient, and they're showing that someone who is sick with COVID disease, not necessarily twice removed, or you had someone in contact with someone, therefore I've been in contact with number 2, and then people are concerned that this is going to be a potential for getting exposed. The stats, you remember the term flattening the curve, and this is one of the arguments that so many people in business are having, in that when we were back in April, the policy was, as soon as you flatten the curve, which also has a direct correlation to not overwhelming the healthcare system, you are going to open up business. And we're seeing the curve being flattened. The left side is new cases over time. The right side happens to be fatalities associated with COVID deaths. And you can see somewhere in early June, we hit a flattening of which it's been sustained now for June, July, August, and September. So we have a 3-month flattening, and still we're having at least the governmental policies are quite draconian to try to keep business down. And we did have restaurants at least open 25% 2 weeks ago. But my argument back in June was, now's the time to start thinking about it and getting people. So July could have been a better time, but that's past us. My discussion back in April basically reinforced what I know quite a bit about, and that's the aspect of dose. And this illness follows the same pathway, that if you have low dose of the virus, then you have a basically low negative effect. The higher the dose, and this gets involved with the proximity and the amount of time, then you have a much more potential for a negative effect. And so what we ended up doing back then, and we still, is that we ranked all businesses 1, 2, 3, and 4, basically to talk about what is a low risk business versus a high risk business. And so we looked at a simple formula here of the risk probability to contract COVID-19 equals what the hazard is, which is the COVID-19 virus, and versus exposure, frequency and duration. We also brought to everyone's attention what OSHA has done, and OSHA basically is taking the approach that this is also a risk-based transmission risk. Some businesses have a very high potential risk, and some have a very low potential risk. When you start looking at rankings of businesses, and this gets into some of the work and some of the aspects of the app we're going to talk about at the end, you really can break it down into 4 levels: minimal, moderate, significant, and high. And when we're talking about 1, 2, and 3, most of the time, these are where the businesses occur. And when we looked at all the businesses out there, we identified that 80% of the businesses, looking at their classification codes, fall into either minimal or moderate. It doesn't mean you don't take any precautions. It doesn't mean you don't have protocols. It just realizes that your business is a very small potential with regards to transmission risk. Some of the significant risks, number 3, are a lot of the businesses that never shut down. And when we look at some of these businesses down here, it's significant. We're looking at grocery stores, for example, a lot of the big box stores. These clearly would be considered a significant risk, as all the other schools, restaurants, airlines. And so the argument was, if you can safely put people into a ShopRite or into other grocery stores or a Walmart or a Costco, and that occurred even during the highest incident periods during April and early April and going into May, then you can also have protection in airlines and mass transit and bring people back to work. The highest risks are the healthcare industries, and I think everyone argues or wouldn't argue that in the healthcare business, you're dealing with sick people, and you're dealing with people that you have to be in close proximity, and that is a much more significant protection that needs to occur with regards to respirators, personal protective equipment, and the like. So here are some of the examples of businesses on the various risk levels. One of the things that I wanted to at least remind people, because everyone knows now and heard the term N95, and they know what a mask is. And just as a kind of a reminder, when you're dealing with various masks, you really have two types of masks. And when you see that these masks are mandated, you go into a grocery store, you go into any sort of retail operation, you'll see that there's a sign that says masks are required for entry. But when we talk about masks, we're not talking about N95s. We're talking about those masks that really are used as a barrier to reduce you as a emission source for the potential virus. So these masks are not intended to protect you from any sort of contact to the virus. They're more to protect everyone else. And I know people have heard this, but it's always good to remind people that there's a difference there, that these are a barrier to protect you and any sort of chance where you would emit aerosols while talking, while sneezing, while coughing, and that's what the mask purpose is. When you look at N95s, you're looking at a mask that has been designed for protecting you from breathing in any sort of small particulates. And they require, if you're going to use N95s as a respirator, and if it's required, if it's a mandated thing, then they're required that you have to have a fit test, that you have to be medically evaluated and approved to wear the masks. And this is where we start getting to the compliance end of things. I've seen a lot of people using N95s as a surgical mask because they're available. And if that's a voluntary thing, then you can make the argument that you don't have to be fit tested, and you don't have to have the medical evaluation because they're still in the voluntary. You're really only using it for the purpose that a surgical mask would also be used for. When the N95, now there's been a lot learned about N95s, and OSHA has come out with a number of policy guidance documents that a lot of it's been very confusing, CDC, and a few things you have to recognize when you have an N95. An N95 is really the material, the filtration material itself. It will protect you when you have, and you're breathing through that material, through the filter. It'll filter out 95% of these very small particles of 0.3 microns. And without getting into the niggly details of how this filtration works, it basically does an excellent job of filtering out very, very small particles. What you really have to recognize from a buyer standpoint is the N95 can be, the material itself, the filtration material can be sewn into a lot of different types of designs for masks themselves. And some of them leak a lot. They're just nothing more than a surgical mask that happens to be built of this filtration material that would be considered an N95. Some of them are designed very nicely to protect you and give you a tight fitting mask so you don't have that leakage. So when you look at an N95, you've seen KN95s, which are Chinese approved respirators, and OSHA has acknowledged that these are acceptable. My experience has been they are not able to pass a fit test. So the majority of people that we fit tested on KN95s, basically they don't work. So they're really more expensive surgical masks. You'll see N95s, and what you want to see when you're buying these things is a certification from NIOSH. NIOSH, the National Institute of Occupational Safety and Health, is the primary body to test and approve masks. And so before COVID, OSHA only allowed you to have N95s that are NIOSH approved. And that would tell you that they at least have been tested to not leak around your face, with the exception that, some sizes will leak around other people, which is why you have fit testing. But if you go to your N95, some of them are not NIOSH approved. And you got to be careful. This is the buyer beware, because if they're not NIOSH approved, they've never been tested, and therefore they're really not, unless you can fit test them and prove it, they're really not going to give you the protection that a NIOSH approved N95 mask would give. I did talk about mandatory versus voluntary. When you start dealing with mandatory use, and there's a nuance here, because a lot of what the state and what CDC are talking about mandatory use of face masks. Well, mandatory use of face masks is not necessarily mandatory use of respiratory protection. And the difference being in that if you have mandatory use of face masks, again, you're using those masks to protect others from you, not necessarily protect you from the environment. So this is part of your respiratory protection program. If you have a business, that you understand what are you actually going to do with regards to requiring your employees to have mandatory use of something, of a mask or of a respirator. And the important thing is, when you start looking at mandatory use for respiratory protection, then you have to have the full requirements of the OSHA respiratory protection standard, which requires a written program, fit testing, medical qualification, training, and so on. And this is what OSHA is actually going after right now, is that they're finding, and they're basically alleging that a lot of businesses have not done any of this stuff because they had a mandatory use of respiratory protection. Another item that I brought up earlier was when you start looking from a workplace standpoint, and if you have people that actually get sick, then you want to make sure that before you classify it as a workplace injury or illness, that you want to confirm this and confirm whether it's work-related or not work-related. And a lot of clients that we've had to date, a lot of the early on COVID-related cases, the preponderance of evidence shows that they were not work-related. They came in, they had people that came that were traveling abroad and so on. So before you start looking and documenting work-related cases, you want to make sure that you have a good understanding what's the evidence to show that it was indeed work-related. However, the good state of New Jersey have just passed a law, and the law was passed in September, so we're 2 weeks ago, and the law basically has flipped this upside down. And just reading what they say, the rebuttable presumption that the contraction of the COVID-19 disease is work-related and fully compensable for the purpose of benefits. So So basically what they're saying, and this is really a compensation standpoint, I should say, is that if someone in the workplace in the state of New Jersey gets ill with COVID-19, then the assumption, the default assumption is that it was work-related. And it's now on the shoulders of the employer to rebut that presumption, which is a much, much harder thing to do than the opposite when you presume that it wasn't work-related and you had to prove that it was work-related. So this is one thing that is really an unprecedented thing. And what's really even more unprecedented is not only is it saying that it must be a workers' comp or disability claim, but the law states that the insurance companies cannot use these incidents to impact your employer modification rate. So your record won't be tarnished in the eyes of the insurance company because you now have 1 or 3 or 5 or as many as they have COVID-19 workers' comp cases, and it doesn't in fact impact your EMR. And if you don't know what an EMR is, it's a ranking that basically shows if it's above 1, it shows that you've had a lot of losses. If it's below 1, you have a decent record. And that's kind of a simple explanation. You can write it down and Google it and get a little bit more information. So the action items, just to kind of summarize the approach that at least the talk I've had, is that when you're looking at COVID-19 and you have your workplace program, one of the things that you want to recognize is, are you a high-risk business or are you not a high-risk business? And you want to make sure you take a risk-based approach to making sure that you have different employee work functions. And certain people have face-to-face contact with the public, or in the healthcare business with patients, or retail with customers that come in, different employees, and so you can't have social distancing. So that would be a potentially higher risk approach. The 3-phased approach is something that has been talked about when you talk about opening up 25% of your office, open up 50%. And I think that's a good approach to try to just get people back to work again. And the other thing is in your Get Back to Work program, and Emilcott's been back to work. Actually, we never really shut down the office because we do a lot of field service options, but we've started bringing back everybody and having a 3-phased approach. We're up to about 25%, looking at 50%. We have a lot of space. So we do have a plan on, and we're very prescriptive about what employees have to do. And these are some of the bullets. What kind of work practices have to change, making sure from a cleaning standpoint, personal hygiene, washing your hands. If there's work clothing involved, not taking work clothing home with you or segregating work clothing before you get back into your car. And then the whole use of PPE with regards to what do you expect your employees to do. And you start getting into some sort of barrier, or as I said, gatekeeper approach, making sure that people will let you know if there's any symptoms, if you're checking for temperatures and so on. And so this is an active program, which is now my opportunity to pass this along to my colleagues, who will talk to you a little about their technology and how that can be utilized in trying to manage this type of program. And that's it.
Hello, can you hear me?
Yes.
Hello?
Yeah. Yes,
Okay.
Inderpal.
Okay. Thank you, Bruce, for that excellent brief on the status of COVID. And in fact, two of the most important things that we have to do as a state and as a country: keep ourselves safe and let the economy be humming and continuing. Before I get started, I'd also like to thank Barbara Kaufman and Chip Hellock for giving us this opportunity and arranging this webinar to speak to everybody about this very important topic of returning to work. So we are going to talk about an app that helps us protect our workplaces. This app has been built out with several medical experts, medical doctors in emergency medicine, critical care physicians, and pediatricians, as well as, so these are three of the doctors who are listed here, as well as some other doctors who have helped the app immensely, but prefer not to be listed at this time. And this app has come about as a result of a partnership we also have with University of Michigan on another app we've been building to help people track their symptoms that we built early on, called COVID Symptom. Just a word about our company. I am the CEO of a company, Kirusa. Kirusa is a New Jersey-based company. We are headquartered in Berkeley Heights, New Jersey. And we are a member of the Newark Regional Business Partnership, NRBP. We are also a member of New Jersey Tech Council, which has now been renamed to Tech United. I've been a member for over 15 years there. And we make solutions that are technology-based and that are scalable at a large scale. Several of them are in the space of building apps and building solutions which a lot of people use as well. So what is a safe reopening? As Bruce has mentioned, as we look at how to keep our economy going, it is very important that we open our workplaces, open our businesses in the midst of the pandemic, while keeping our workers safe and while keeping our workplace safe and inviting and comfortable for having visitors and having customers come in. And of course, we have to follow all the rules that our state lays out. Some of the restaurants have opened up 25%. They're going to open up even further as we get into the winter, assuming our infection rates and death rates stay low, which we all have to work to maintain to keep the economy humming. We, as a part of that, the CDC has various guidelines on how to call back your workers. And whether you're in a business environment, a business office environment where people are coming to office, in the retail environment, in the shopping area, in entertainment and industry, in hospitality industry, all of these businesses have this challenge of following the guidelines of CDC, of our state, and making sure we are keeping records, making sure we are giving comfort to all of our staff. So this app does is, it provides employees a way to self-report every day, even before they come to work. So it's like a virtual screening that they can do themselves of whether it is okay to come to work or not. And that is then determined, that analysis is done by the app by looking at various factors that you have self-reported. And it is not just based on what you self-report today, but is based upon the history of what you have been going through over the last several days, sometimes as much as 2 to 3 weeks before today. The employers get access to dashboards So usually it's the HR manager or the office manager, depending upon the size of the business, or a health care manager in the business. So who is looking at how's the staff doing, how's the staff responding to COVID. So they get access to those dashboards as well. So there are also some things that this app does not do. And I think that's also very important to ensure for the privacy of our workforce. The information that we collect, it does not collect any information about location or about contacts. Where have you been? Who are the people you are meeting? There is no interaction with GPS or Bluetooth whatsoever. It's only based upon data that the employee considers self-reporting on by himself or herself. And the reporting of the data only that is relevant to COVID, and that is coming out from the medical guidance or the CDC guidance or the state guidance that is being provided. In some industries, there are regulatory requirements of record keeping. This provides a way to keep records in a paperless manner, which are available to the employer as well. So let's talk about how does it work for employees? What does the employee have to do? And basically, it's the employee gets a notification, and as they get a notification, the notification comes in every day. The employee clicks on the notification and he's taken to a page where he can self-report symptoms that are COVID related. The app has a good track of what those symptoms are that we should ask the employees about. Also, if the employee has been tested about COVID or tested about the antibody tests, the employee can report their results. And there's also a question about travel history, which is another very important factor in determining the risks related to COVID. And based upon these questions, a virtual health screening is done by the app. And the employee is shown either a green check mark, which means that it is okay and safe to go to work, or a red check mark that he is advised to work from home or stay at home or not report to work, whatever the practice of the business is. The whole analysis is done in the background based upon techniques that have been advised by the CDC and the state. And for the employee, he just does a self-report. It can take anywhere from 30 seconds to a couple of minutes, depending upon the level of data to be entered. For most cases, it's less than 30 seconds to enter this information. And he just sees a result, which is either a green or a red check mark. Typically, this information needs to be re-entered at least every day. But this is again something that's customizable depending upon the business practice. And if the employee has not entered the information for a day, then he sees a yellow check mark saying, please, you have to enter the data. At this point, I'll hand it over to my colleague, Ravi, who will actually demonstrate this working to you live. Go ahead, Ravi.
Excellent. So let me, hello everyone. So as a part of the workforce, every day I get an alert on my email and I can initiate the Safe Reopening app and start a new self-report. I tap on the new report. It simply asks me, it's a very fantastic and user-friendly interface. It asks me, okay, how are you feeling today? I said, I am feeling very well. I go on to the next screen it asks you another question, would you like to report a test? If I say yes, it will ask me that, okay, would you like to report a viral or an antibody test? I click on viral. It provides me various options that when did you have the test? I can report test backdated by 2 weeks. And it asked me that, okay, how was your test administered? I have 4 options, and I select a spat in a cup or tube. What was the test result? I can decide whether the virus was detected, not detected, or result not clear. Do you have any symptoms on the day you were tested? I would say yes. I can select any of the options, but right now I'm feeling well, so I'll move forward with it. So I don't want to report any test. And then it asked me a question related to my travel history or my contact information that in last 14 days, have I been in close contact with someone who has tested positive? Well, what does it mean? I have an information tab here where I can check the meaning of this statement or this question. That contact means that you were less than 6 feet away from the person for more than 10 minutes. And I say, no, I go forward. I have to report my travel history, or have I traveled to any place or returned from an area which is covered by travel advisory? What is travel advisory means? I click on the option and it provides me various guidelines related to travel advisory issued by various federal department, state department, and various states. So let me look at the New Jersey travel advisory, and I see a list of all the states which are part of the travel advisory. So, well, I have not traveled to any of these states. So let me go back and I say, no, I have not traveled to any such places. And now it asks me that, okay, I'm certifying that all the information I'm providing here and I have entered related to my symptoms, testing, contacts are best of my knowledge are true. So I certify and submit. Oh, wow. The app says I'm okay to go to work, and immediately my office gets a report. Let me start and show you a new self-report. When I'm not well, I can click on unwell and it gives me various options that, okay, what is happening to you? Are you having fever? Yeah, I have a cough as well. What does it mean? Wet, dry? Various options are there. There is an information tab which gives me the definition of what it is. I select a dry cough. I have a headache. I also have sneezing, and I have a stomach ache as well. And I check on next. It asks me, since I've selected that I have a temperature, it asks me that, okay, can you report your temperature? Let me say I report 100.8. I can even skip this step. I go to next. Would you like to report a COVID-19 test? And let me say here, no. In the last 14 days, have you been in close contact? Now I'm not sure after these symptoms. So I say maybe yes. Now this asking me that, okay, to the best of my knowledge, when did you have the contact? Let me say maybe over the weekend, Sunday, I might have gone somewhere. I go to the next. I have not traveled to any location which is covered under travel advisory. And then it asks me that, okay, can you certify that the information you have provided is correct and to the best of your knowledge? I say yes. Oh, I get a red check, which means I'm recommended not to go to work. So as you can see, both the scenarios which I demonstrated right now to you, it is so simple to report and go through this process. It is altogether like each step is all less than 30 seconds. Okay. So this is the way it is very simple for every employee to dedicate 30 seconds of his time to complete this self-report and make sure that the environment he's entering into is safe and healthy. Over to you, Inderpal. Thank you.
Thank you, Ravi. Thank you, Ravi. So I'll move on to talk about the other side of this application of how do the office managers, the HR managers see it. They get a number of reports every day, and they also have access to real-time information on a dashboard. Some of the reports include like a daily summary of how many people have reported their symptoms, how many people have been recommended to go to work, and if there are any people who've been recommended not to go to work, this is available. There's a detail available if the HR department is to send out messages to those employees who have not reported, to ask them to report. They have a list of the employees who have not reported, so they can send those out. So again, there's an extensive set of reporting available. Finally, let me come to pricing. We have kind of worked on a pricing model that makes this accessible to every business. Again, the goal here is to make the service available to all our businesses so they can open safely. So for any business that is less than 10 employees, this service is completely free, and it will stay free for employees less than 10, for businesses less than 10 employees. For businesses more than 10 employees, there's a fee of $2 per employee per month. There is no fee to get started. There's no fee to get onboarded. It's just a monthly fee of $2 per employee per month. Plus, it is free for the first 15 days. So any business can come in, test it out, see if it fits their needs, their employees like it, and then if they decide to continue beyond 15 days, it's just a $2 per employee per month. For large businesses, we also provide an iOS app that they can provide to their employees. And it's very easy to get started. Just go to the website, and one can any business can create an account and use the service. We are also offering to all members of the Newark Regional Business Partnership, as well as to anybody who's attending the webinar, even if they're not members of NRBP, a 25% discount on the pricing. So we encourage everybody, as you open your business, see how to make it safe. And if this app helps you achieve that, we'll be delighted to serve your needs and to help your staff as well. Thank you.
Great. Thank you, Bruce, Inderpal, and Ravi for excellent presentations. I just will give a reminder that in the chat box, we have the information about how to get the 25% discount on the app. Question for Inderpal and Ravi. Is the app available for both Android and iPhone?
So the app is available on both Android and iPhones. It is available as a web app, so there's nothing to download. You get notifications in the app, and you use it within either the Safari browser or the Chrome browser. In addition, for large businesses which are defined as having more than 100 employees, it's available as an iPhone app as well. So any of your employees can download and report it from their iPhones as well.
And how does your app compare to, because there are a number of other organizations that are providing apps. Are they all fairly similar? What would somebody look for when they're deciding which app to pick?
So at a very high level, this is a real need in the market. So there are many organizations that are trying to help out and offering this app. Some of them are bundling this with existing offerings they have, like Salesforce is bundling this. If you are a Salesforce client, then you can use this as a part of the Salesforce offering. Or some insurance companies are also bundling this as a part of their insurance offering. This app is standalone. You don't need to be buying a big HR system from us or a big Salesforce system from us. It's a standalone app available to you, quick to start, quick to get going. There's no big system to deploy at all.
Okay. And Bruce, just going back to you for a minute, in terms of the HEPA filters for an environment, whether it's a restaurant or an office environment. Does getting a HEPA filter help with reducing the amount of transition that might be possible when people are in the room? You talked about proximate, and if they're proximate for hours at a time, for example, in a restaurant setting where they might have their masks off while they're eating, is a HEPA filtration system helpful?
Well, a HEPA filter does filter out the virus-sized particles. So if you think that you're within a close proximity of someone who's not wearing a respirator, not wearing a mask, that would be helpful. I mean, this is where, if you have 100% compliance with people wearing masks in areas where people come together, then a HEPA filter typically would not be necessary. But if you are a server and you are with people and you're serving and leaning over people who are not wearing masks, then as a belts and suspenders protection, the filter would be adequate.
Mm-hmm. Yeah. I think one of the decisions that everyone will have to make as we head into the fall is in terms of indoor dining. For servers, they're wearing, ostensibly they're wearing a mask that is not an N95, and so they're not protected from the diners who are sitting there without masks on. They're going to be exposed over numerous hours. So just wondering, to what degree are restaurant workers more endangered as people come indoors? And secondly, as a customer, if you're sitting there and have your mask off while you're eating, and everybody else has their mask off while they're eating, as people try to evaluate whether they want to do that or not, what do you think is a good guideline?
Well, let's take the question in two pieces here. If you're dining with people that you know, very similar to what the purpose of the app is, to have people make sure that they are healthy enough and understand what their risk is with regards to exposing people, that should reduce your risk as either family members or friends in a kind of tabled environment. A lot of restaurants increasing their fresh air flow. A lot of buildings are doing this. One of the recommendations I have is to increase your turnover air. That's much more important than even looking at the filtration of your HVAC system. It's a lot cheaper to increase the volume of air that would go through your existing ventilation system. And that actually does a nice job of at least potential for transmission risks to servers that are going to be inside the area. Plus, they're reducing density, so they're not packing them in. And I think that's where the data is going to be interesting to see, with people coming back inside with lower density. Are you going to see a significant uptick, just a little uptick? So we're all kind of interested to see how that works out.
Okay, great. Thank you. Well, with that, I will ask Chip to come back on camera and give us some concluding remarks.
Thanks, Barbara. And thanks, Bruce, Inderpal, and Ravi for sharing with us this afternoon. Really appreciate it. And Inderpal and Ravi, your creativity in creating this app and also making it available for free to very small businesses is a credit to you, and certainly a tool that they may be able to use to help keep track of and have their employees keep track of possible symptoms and making that decision about whether or not to come to work. So thank you for doing that, and thanks for making it available widely to members of NRBP and many others. And Bruce, thank you again for joining us and talking about things that we have to keep in mind as we continue to fight through this pandemic. You're balancing the risk factors and really thinking things through is is very measured and very appreciated. It's great to hear a very practical, sane approach to talking about these issues. So thanks very much for your expertise and joining us once again and sharing with our members. We appreciate it.
Thank you.
As Barbara said at the beginning of our webinar today, we've got a lot more programs coming up, and we certainly hope that you'll take advantage of them, whether it be networking, whether it be another part of our diversity, equity, and inclusion series, or our regional economic outlook on October 14th, where I think you can get some real insight into what economists believe will be the picture for the coming year, as well as listening to industry experts talk about how they expect this coronavirus, the pandemic, to continue to affect them. We'll also give you some insight into your planning, your budgets, and what your expectations are for sales in the coming year. So we do hope to see you again. Once again, Inderpal, Ravi, and Bruce, thank you for spending time with us today. We look forward to seeing you all again. Be safe. Thank you.
Sure.